In this video today, I'll be talking about controlled drugs as found on ships and what are the requirements and expectations from you as mariners to deal with controlled drugs on ships. This is part of the medical care on board ships. Controlled drugs, or sometimes they are known as scheduled drugs, are those that in most countries are subject to prescription requirements, limiting their distribution and use because of their liability to be abused. A ship must not carry quantities of controlled drugs which are larger than those specified by the appropriate national regulations unless required by the doctor. A few examples can be considered as morphine, adrenaline, amethocane, atropine, and some other drugs. So there is a list of drugs that will be prescribed by your flag state, which will list those drugs under controlled drugs, and those drugs will be kept in a separate box, most likely in the master's cabin. Some of these drugs are required to be refrigerated and they will be kept in the master's refrigerator under his or her custody. The 1961 United Nations Single Convention on Narcotic Drugs includes provisions that stipulate the international carriage by ships or aircraft of such limited amount of drugs as may be needed during the journey or voyage for first aid purposes or emergency cases shall not be considered to be import, export, or passage through a country. A second provision stipulates that appropriate safeguards shall be taken by the country of registry to prevent the improper use of these drugs or their diversification for illicit purposes. Now, many of these drugs have been abused by drug users, and that is why it is important that it is kept under the custody of a responsible officer or the senior most officer on board the ship, which is the master. National regulations of the country visited, however, predominate and must be respected. National authorities of many countries require ships' masters to produce a general declaration of medicines on board and a separate declaration of controlled drugs, and to keep a drug register for 2 years after the date of the last entry in it. The Maritime Labour Convention contains guidance on national authority responsibilities in this matter. Smaller vessels could carry or should carry medical supplies in accordance with the relevant voyage guidelines and in relation to their needs as determined by length of voyage and number of crew. National authorities of many countries require ship masters to produce a general declaration of medicines on board and a separate declaration of controlled drugs as stated before. Regulations relating to records to be kept concerning the use of controlled drugs vary from country to country. Generally speaking, these records should be kept separate from patients' ordinary medical charts and should give the following information: doses given, including the name of the person ordering the dose, the name of the person administering it, and the name of the person receiving it, date and time when a dose was lost or spoiled, a running count of remaining stocks updated after each use, and a count made at least weekly of remaining ampoules, tablets, etc. in store to be checked against the records of use and the running count. Regarding controlled drugs, regulations regarding record keeping vary between countries as well. The records should be kept separate from patients' ordinary medical charts and should give the following information as stated before. Now remember, why I am reinforcing this point is because many a times it has been found on ships that medical or officers who are in charge of the hospital do not keep appropriate records. So you should not only be keeping appropriate records, but these should be countersigned by the master. Such records should be able to be produced when the port state officer or a flag state officer or the ISM auditor come on board and ask you to reproduce these records. Finally, controlled drugs must be landed if they have been expired. They should be provided to a legitimate party who can get rid of those drugs, and you should obtain evidence of such landing. So a receipt should be obtained from the person who's collecting these drugs and destroying it, and that receipt should also be part of your medical records that concern controlled drugs. Now, controlled drugs inventory, making sure they are replenished when they are expired, all that may be the duty of an officer on board a ship, and they are supposed to be following it and carrying it out under the supervision of the master. If you are the master, then it is your duty to be aware of the drugs that you have in your cabin. You do not give access to unauthorized persons or any persons on board. People should not have access to these drugs in your absence. An inventory should be maintained by the master as well, and an eye kept on the use of these drugs. One point here that I want to mention, that some drugs may be considered as controlled drugs under your flag state or by the administration. However, if you go to a separate port or another port, there could be some additional drugs which are considered to be as controlled drugs. Make sure as the ship's master you are aware of the drugs which are considered controlled drugs in other ports. You can seek the shipping agent's help in this regard. An example, if you go to the port of Lagos in Nigeria, many drugs that end with the letters E and E are considered to be controlled drugs. So you may have to find out which of these drugs end with the name E and E. You also have to be aware of the drug's shipping name and popular trade name. Some of these drugs are controlled drugs based on their shipping name or sometimes based on their trade name. So be very aware of what the drugs are that are found on board your ships and whether they are controlled drugs or not, under not only your flag state and administration but under the flag state administration of the other countries. In that case, when you go to these ports, you must separate these drugs from your regular medicines, make a separate box of it, take an inventory and declare it to the port authorities. So this was again a short video on controlled drugs, the use of controlled drugs and the requirements regarding it. I hope you like this video. Let me know through a feedback. I'll see you soon with my next video, guys. Keep studying and study hard. Bye.